Hi everyone, welcome back to another episode of Health Beyond Borders brought to you by the Malaysia Healthcare Travel Council. I'm Hamida, your host for today, and today we're going to talk about a very interesting topic, in vitro fertilization or IVF treatment. And to do just that, we have with us one of the leading fertility centres in Malaysia, Alpha IVF. Kita ada Dr. Leong YU, consultant obstetrician and gynecologist and fertility specialist, and also Ms. Maslinda Mohamad, assistant manager of sales and marketing Alpha IVF. Thank you so much
Thank
for
you.
joining
Thank you.
us.
Good morning,
Good
Hamida.
morning.
Good morning.
Thanks for having us.
Okay, so doctor, when we talk about IVF, actually personally I pun tak berapa tahulah
Yeah.
pasal IVF ni, and I think a lot of people don't actually know unless you're actually seeking for the treatment, unless you're trying to
Correct.
conceive.
That's right.
So can you help explain to us, like we're 5-year-olds, what
Yeah.
is IVF all about?
Sure, Hamida. To make it very basic, yeah. So IVF actually is a process whereby we get the eggs from the mummy, all right, and we harvest it out of her body, and then we use the sperms from daddy, and then we will try to fertilize those eggs with his sperm in the lab, and we get embryos. And the embryos we will culture until they become mature embryos, ready to implant and stick into the womb to become babies. At that point, we can either transfer back straight to the womb, or in modern day, we freeze them to be used later.
Okay. So when you talk about getting the eggs and the sperm from mommy and daddy,
Right.
at one time, how can berapa banyak you boleh
Yeah.
get from each of them?
Yeah.
And
Sure.
like, is there a specific time, especially for mothers lah,
Yeah.
for you to get the egg? Macam kena tunggu, you have to keep up with your calendar, cycle ke
Yeah.
macam
Program
mana?
IVF sebenarnya bergantung pada the period cycle of the lady, because as a lady they have this reproductive cycle which we call period cycle lah. So basically we start the injection of hormones basically on the first day of period or second day of period.
I see.
Kita ikut dia punya cycle. So we have to go with the flow of the natural biology of the woman. So naturally a woman will produce one egg per cycle. That's why they have one baby at a time. That's
Okay.
natural. So but in IVF we give them hormones. So in that cycle she produce more eggs, more than one. How many eggs she can produce depends on her. So some women have more eggs genetically, some have less eggs. But in general, as you age, you get less and less eggs. Sehingga menopause kelak. When you reach menopause, zero. So we will try to stimulate those eggs during that batch to mature. So we will retrieve them so we can make more embryos in the lab.
Okay, so when you talk about this treatment, basically it's nothing short of a miracle, right?
Thank you.
So how long has IVF been around actually, and how long has Alpha IVF been around? Maybe Ms. Linda can, cerita sikit pasal Alpha
Yeah.
IVF. Yeah.
Yeah.
Okay.
Go ahead, Lina.
Okay.
Let's talk about the history.
Yeah, okay. History is like Alpha Group ni as a, cause actually we are the group. So we have
Okay.
4 center currently. Satu di Penang, 2 di Kuala Lumpur, and 1 di Singapore. And soon we're going to have more and more IVF center and also satellite clinic. Sekarang ni kita ada 2 satellite clinic di Indonesia. Satu di Jakarta and 1 di Surabaya. Selain itu kita juga ada site office, 2 site office di China. Okay. So how long dah, berapa lama usia Alpha ni? As a group dalam Malaysia, kita lebih ada berpengalaman lebih daripada 32 tahun. In fact, the first IVF doctor in Malaysia is one of our Alpha doctors, Dr. Haris Hamzah.
Masih
Yes, dia masih lagi
with us.
active. Yes,
Yeah.
dia masih lagi. So maksudnya the first IVF babies sekarang ni umur dia dalam 31 tahun, 32 tu is from magic hand of Dr. Haris Hamzah.
So basically since 1993 macam tu lah dah adanya
Di Malaysia.
this
Di Malaysia.
Yeah.
technology in Malaysia.
Correct.
Yes.
But
I see.
from the world, the first IVF baby is from 1978.
Wow.
Yeah.
But of course along the way, along the years, banyak perkembangan teknologi kan. And then at Alpha, we always the top. Kita sentiasa ada teknologi yang terkini dan juga ter-advance.
Okay. So when we talk about technology, I think for IVF kita dah gunakan AI. Tadi I sempat sembang dengan doktor. So he was talking about how AI is helping us choosing or identifying DNAs, you know, for the eggs, if I'm not mistaken. So maybe you can talk more
Yeah.
on the current technology.
Sure. AI is everywhere now.
Yeah.
Even budak-budak buat kerja rumah pun pakai ChatGPT kan.
Betul.
Anyway, yeah. So how AI helps is exactly as intended, using software, to look at the state of the embryos. So specifically, what we use AI now in Alpha, we have started way back, many years back even, is to look at the embryos and also the human sperm. So let's talk about embryos. So when we assess embryos, we look under microscope obviously sebab dia kecil sangat kan, mata pun tak dapat. So we zoom in and we look at the structure of the embryos, the cells, whether each cell is symmetrical, whether it's clean, any problems with cells, all those things. So the better looking the embryo, or we say a textbook embryo, the higher the grade. What does it mean? It means a higher chance to implant or be successful to become a baby in general. So when we grade them, we look under microscope. So in AI, what they do is they take a picture, or they look at the software will look at the picture of the embryo and look at the same structures an embryologist would look for under microscope. So as we know, human beings, we are not perfect creatures. Kan? Sometimes, we may be not at our A game. So when we look at the microscope, we will miss some things or we may have some mistakes. But computer, as we know, you program, I need this, 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 this. So when they look for that, they see that, they document. So they also grade it based on a still picture of that embryo, as in an embryo is looking. And we compare. Of course, in science, we cannot completely believe in AI. So we compare the notes between embryologists and AI, and we compare. Most of the times in expert embryology hands and good AI system, you see it's similar. So it's good. But if there's discrepancy, something somewhere is not right, then we audit ourselves and betulkan. And we double check. For sperms, same thing. AI juga. So they look at the sperm punya, kita panggil morphology ataupun bentuk dia, the head, the tail, the structure. So it's a good structure sperm. It's supposed to be good sperm, can fertilize the egg properly. So those would be graded as good sperm versus abnormal sperm. Same thing, the AI does that. Not only the AI can look at the structured sperm, it also can track the movement. But the software will have a computer eye tracking the movement of the sperm.
Wow.
Some of they're going circle, yang tak berguna, not useless one doing donuts, ataupun yang going straight. Those
So
that go
that
straight.
would be the good sperm lah.
Yes, so they will give a breakdown and they will list down, just print out all the parameters.
Maksudnya dari sperm pun dia dah aktif and like
We've been doing it, yeah, we've been using it. So it is faster than the human eye. Because human eye, how good you are, you have to see one sperm, and document. That one they can look at all 50 sperms sekaligus. That's the beauty. That's the beauty.
So for this particular technology, how long has it been around? Kalau tadi the IVF itself tu from the 70s.
Yep.
So for
This is
AI
new.
ni,
Yeah, this is new. So technology, it takes a few years to develop. So even the AI sperm, the developers, of course, from different country, they have been working with us when they were even developing. So Alpha, we are proud to be part of the development process of all this AI. So they use our patients and our input to develop the software. And now it is software is available. It's all over the world now.
Wow.
And we've been using it for more than a year now. Yeah,
I
but
see.
we are proud to be part of the team that helped develop the program.
Okay, if I may add on little bit.
Yeah.
So dengan adanya teknologi AI in Alpha ini, kita cross check AI and biologist. So dengan itu kita dapat mengurangkan kesilapan human error
So
di
the
situ.
success rate tu lebih tinggi lah.
Yes, betul. Dan dia menyumbang kepada our clinical pregnancy rate lah.
So Malaysia is actually one of the contributors in terms of
Yes. Yeah,
IVF
that's
treatment for the whole world lah, basically.
Yeah.
Yeah.
So
Well, a lot of people don't know that Malaysia,
Yeah.
we have a lot of things, we can do a lot of things.
Yes,
Yeah.
and actually IVF treatment is also one of the most sought after treatment by our international patients. So kalau macam Miss Linda, actually how often do you receive international patients? Daripada mana?
all the time.
All the time.
All the time. Daripada usually daripada negara mana?
Okay, kita memang actually I can say that 60% of our patient is from international.
Oh, okay.
Yeah, so kebanyakannya daripada China, daripada Indonesia dan juga sekarang kita sudah start juga receive patients daripada Middle East, daripada Myanmar dan juga negara China, Hong Kong, tu memang ada lah kan. And then from Singapore also, ramai juga daripada Singapore dan negara yang lain-lain tu pun ada juga.
Even Europe, parts of
Europe
Europe.
pun ada.
Yeah.
Hong Kong, Japan.
Yep.
So actually, how did they come about to sebab ada banyak lah of course fertility centers in the world, in their own countries.
Yep.
So apa yang membuatkan diorang datang ke Alpha IVF? Is it word of mouth? Is it your social media ke atau macam mana?
Okay, it's not that because I'm alpha, tapi memang I have to akui team sales and marketing alpha ni dia macam piranha, you know. Dia dengar je ada peluang tu, kita pergi. So actually okay, alhamdulillah jugalah dengan bantuan MHTC kita banyak juga explore new market, contohnya Middle East, kan? And of course kita ada juga existing matured market seperti Indonesia and China. And how kita market kan, of course melalui social media, IG, TikTok, Facebook, and then kita juga aktif join MSTC punya booth event. Nah, sebenarnya lagi ni nanti nak masuk tahun Merdeka
Malaysia Year of Medical Tourism.
So lagi insyaAllah kita akan lebih aktif bercollaboration dengan MSTC.
Okay. So of course other than that, it will be the success stories lah by Alpha IVF. So what is the success rate for Alpha IVF sendiri?
Okay. Kita punya clinical pregnancy rate one of the highest in the world. 87.5%.
Wow.
Of course it's not 100%. We are not God, but 87.5% tu antara yang paling tinggi. Because
Tinggi di dunia lah.
yes, I've been to Middle East and dengan MSTC juga last month. Diorang yang paling tinggi is 40%.
I see.
So rata-rata center is dekat Myanmar, dekat Cambodia, it's at 30-40. But we can offer more. 87.5% dengan teknologi-teknologi yang kita ada. Of course dengan doktor-doktor yang berpengalaman, contohnya Dr. Leong. So those things yang contribute on the success rate.
So our panel of doctors, kita punya teknologi yang special lah to Malaysia. I think we can say that Malaysia is more advanced in that sense.
Sebab dia setiap kejayaan IVF tu, dia bergantung kepada doktornya, embryologist, yang di operator lah. Dan of course kita perlukan lab yang terkini, yang canggih juga.
Which we do have in Malaysia.
In Alpha.
In Alpha IVF.
Tiga-tiga ni adalah antara pemangkin utama untuk kejayaan IVF.
Okay. So, I nampak dekat you guys punya social media, because I haven't been to your hospital yet. Maybe one
You're
day
welcome.
we'll pay a visit. So dekat your hospital tu ada macam loceng, ada bell. So what is that bell all about? Is it
Bell of joy.
what is that?
Okay. Bell tu adalah amat special pada kami sebagai warga Alpha dan juga pejuang garis 2. So setiap kali kalau mama berjaya pregnant, kan kita ada pregnancy test kan? So we will ring the bell, akan pasang lagu, and then kita semua akan tepuk tangan, akan menyanyi our traditions. Kita meraihkan kejayaan papa mama.
I see. So how often do you actually, ring the bell?
Every day lah.
Every
Every
day.
day, alhamdulillah. Yes.
Every day.
Yes.
Is it like more than once?
Of course more than one.
Wow. So ada number tak actually in 1 year tu berapa banyak kali you ring the bell? Tak ada. Terlampau banyak.
We do audit. I can't roll it off till my tongue, but we do audit our cases. Of course, that's why we always have a check and balance audit, which we publish. We openly publish for public to see. Yeah.
Okay. So, alright. So, Dr. Leong, when we talk about IVF, kita cakap pasal gynae, OBGYN.
Correct.
So, usually dia lebih kepada perempuan, kan? So for doctor yourself, what made you choose this particular field?
Yes, good question. Of course, for IVF specialists, on the basis kita pakar sakit puan dan bidan. We are OBGYN, like you said. So IVF tu ataupun reproductive medicine, kita buat satu subspecialty. So after we become specialist in OBGYN, then we subspecialize in this field, reproductive medicine or IVF, as you said. Why I chose this field? Because it's very fulfilling. Okay, it's very fulfilling. When I started after I become OBGYN, of course, my direction was towards treatment of female cancer. You
I
know, so I
see.
was thinking along those lines, which is a great field. You know, because it helps so many women. Tapi it's quite sad lah sometimes. Cancer is something that even in the best of hands, you know, God's grace,
Yeah.
ada kala, you know, people do succumb to it. Very sad. You know, sometimes I go home sad, and so not a good feeling. Whereas IVF, you help
Mm.
bring life and joy to people.
Yeah.
You know, we are just helping God, you know, to help them. We are along the pathway. So with God's grace, we are able to help them have a zuriat, have children, yeah, which
Yes.
they may not have naturally,
Yeah.
and then we bring happiness. So
Betul.
every time, like you said, that when the bell rings, I feel a glow inside. It's happy. It's happy. We feel happy for them. So I
Yeah.
go back every day happy. So that is what makes me dwell in this line.
And then
Yeah.
kita punya slogan pun is generating
Generating
generation.
generation.
Oh,
Yeah.
generating
Yup.
generation. Okay. Oh, okay. That's a nice wordplay.
Catchy, yeah?
Yes.
Catchy.
Yeah, yeah. Generating generation.
Yes.
Okay. So, tadi doktor ada mention about cancer.
Mm.
So for cancer patients atau cancer survivors, is it still possible for them to do this IVF treatment, and what would be your advice?
Okay, for sure, for sure. You know, they can still become mummies, daddies, right? But they have to have awareness, which is hopefully, you know, like what we bring in today, you know, help create awareness. So invariably, after somebody's been diagnosed with cancer, maybe some will go for surgery, some cannot be surgically removed. Invariably, it may involve some chemotherapy or radiation as what we call adjuvant treatment, additional treatment. So when women or men they go through chemotherapy, say the agents, the chemo agents will also destroy other cells, namely the male testicles and the female punya ovary lah. Sebab those chemo agent dia suka attack benda yang aktif, cell yang aktif, which is the cancer cell. At the same time they attack
Whatever
other
other
active
cells
cells, which
yang
is the
aktif
eggs
lah.
active kan and
Yeah.
sperm active kan. So they attack those as well. And the problem with the we call gonads, gonads ataupun the female ovaries, the male testicles, the cells cannot regenerate. Once
I
damaged, they
see.
do not have the kemampuan, the ability to regenerate. Like brain cells, you know, you have damaged stroke, you know, you may be paralyzed for life. They don't come back. But my skin cells, if I jaga, dia tumbuh balik. My bone cells, if I patah tulang, I put plaster, it grows back. Not the testicles or the ovaries. So we tell them, look, I know you need treatment. You know, we work in hand with the oncologist. Freeze your sperm, freeze your eggs dulu sebelum you go chemo. If the worst really happens, no more eggs, no more sperm because of the therapy, we still have something to fall back on. Frozen eggs, frozen sperm.
So, if they actually don't know about this, the after effect of chemo, I think the usual would be hair loss, things like that. Tapi in terms of your reproductive cells, I think not many of us know.
Correct.
It
Yeah.
can, in a way, be permanently
Yeah, your doctor
damaged
say, don't
lah.
worry, your hair
It,
will grow back. But they never talk about, you want to be daddy or mommy in the future. They didn't talk about that. Then by the time it
yeah.
happens, too
Too
late.
late already.
Yeah.
So you do have, do you get patients yang they're cancer survivors,
All the
they've
time.
gone through
All the
chemo?
time. You know, back in the day, you know, we like we said, we have a lot of patients yang dah buat chemo dah treated dah. They come to me, oh, I had cancer 5 years ago, 4 years ago. I dah fully sembuh dah. I want a baby now. I was like, oh no. You know, I look at the reports, the blood test reports, the sperm test report, everything. Do the scan, look at the ovarian function. Terlambat.
I see.
As long as not zero, of course, have to do bayi tabung lah, IVF. You know, try to get whatever eggs out, whatever sperm left, you know, to try to make babies. And we've helped so many patients with that. Unless it's like total destruction of the testicles, then we're in trouble.
So there's actually still hope lah for.
There's still hope. There's still hope. As long as it's not like total failure of the gonads, you know, of course, IVF will be able to help. For sure, be able to help.
Okay. So when you say freezing the eggs or the sperm, how long can you actually freeze?
As long as you want, you know. It's like imagine keeping money in the bank, you know. So as long as the bank is there, you can withdraw your money anytime.
I see.
And the
So,
beauty is, the eggs, when you take them out in the future, let's say 10 years later, the quality of those eggs will still be like when you were young 10 years ago.
wow.
So you have aged, Tapi the telur is still muda macam you dulu. Masa you freeze.
How do you actually keep it? Macam I'm trying to imagine. Is it a fridge? Is it a
Yeah, it's like
petri
like
dish ke? Macam mana?
like those food industry, very advanced kind of, we call it cryo vats, these huge big stainless steel vats. We use vapor phase, not the old school just liquid nitrogen rendam macam tu aja. We use vapor phase liquid nitrogen. So we keep them all, using computer to check temperature regulated, alarm systems, all there, to keep them safe and sound.
And it's applied to embryo juga. Dia bukan setakat egg and sperm. For
Boleh
embryos.
freeze embryo juga, yes.
Oh, okay. So, okay, the first step is getting the eggs and the sperm. And then you satukan dia menjadi embryo. And if you're still not ready, you can keep.
The
Yes.
embryo.
In fact, the modern day treatment of IVF is to freeze everything dulu. Then when you're ready, you can transfer anytime.
Okay, bila you cakap when you're ready, what is ready? Is it the mother punya health atau mental ke atau macam mana?
Well, good question. Some patients they want to have IVF, but say maybe this coming months I'm quite busy with something. I got a lot of traveling plans.
So basically, you can choose lah when
you
you
can
want to get
choose. Yeah,
pregnant.
you can choose. Some say I want to try natural dulu. Yes, I know I got these embryos, but give me a chance to try natural. By all means, go for it. You always have something to fall back on.
Okay.
But even naturally in IVF, so if I want to be very specific, if we do IVF nowadays, once we get the embryos, I need to rest the mom a bit because they go through all the injections of the hormones can. So we rest about 2 period cycles, about 1.5 months, we can transfer. That's the
So
bare
as
minimum
quick
lah.
as around 2 months lah from the first process.
Yeah. I have patients, transfer the embryo. Once they done IVF, they transfer the embryo. She came back 7 years later for the second embryo because it was frozen with the first one. 7 years later, I transferred, she got pregnant, she delivered. So the two babies 7 years apart, but actually made during the same time. Masa IVF, that because of COVID, there's a lot of things happening, right?
So you've been keeping the embryo for the past 7
Dia
years.
macam kembar
Yeah.
tapi lahir lain tahun.
Yeah, we spaced them out.
Yeah.
Okay, so we have covered a lot, on what IVF is all about. But I think we'll take a short break, and we'll get back to this topic.
The World Health Organization
has revealed that
found
1 in 6
couples struggle to get pregnant.
In a world grappling with rising infertility challenges, Alpha IVF Group offers hope and solutions. Emerging from the inception of Alpha International Women's Specialists in 2011, it has grown into a group comprising of Alpha IVF in Kuala Lumpur, Genesis IVF in Penang, Alpha IVF in Singapore, and Al Haya Fertility Centre, providing arguably the most complete fertility solutions in the region. Alpha IVF Group, a trusted leader in advanced fertility treatment, offers a range of services from fertility assessment to treatments like IUI, IVF, ICSI, and pre-implantation genetic testing, fulfilling the dreams of couples seeking fertility solutions.
Okay, we're back, on this interesting topic that we've been discussing with Alpha IVF, Dr. Leong and Miss Linda. So tadi kita dah cakap pasal what IVF is all about, some things yang perlukan clarification for those interested or those yang memang tak tahu apa-apa pasal IVF. But now I would like to go maybe macam a bit personal on your personal daily life lah for Dr. dan Miss Linda. As a doctor, as an assistant manager working at a fertility centre, what is the most challenging part of your job? Or maybe, during the day, what is the most challenging
Any
part?
challenges?
Challengesnya, okay. Sebab kita selalu buat roadshow, and then sebelum doktor jumpa patients, kita orang jumpa dulu. So we build a relationship first. Saya ada a few patients yang kita start from strangers, tak kenal, and then I accompany them from the journey, from the first treatment, second treatment, sampai lagi di OPU. So of course, although that we have a very high success rate, but again we are not God. Kalau Tuhan kata kun fayakun, tak ada, so rezeki maksudnya tak ada lah, kita kena try lagi kan. So kalau adanya joy story, we celebrate together, and the bonding is very strong between us. Kalau tak ada tu, kita share juga dia punya sadness. And of course as a mother tu kadang-kadang if I may share lah, ada satu patients ni, we call each other bestie already. So I met them dekat Jakarta, dekat Surabaya. They follow I punya show 2 kali, good show.
Okay.
So bila kat Surabaya, end up she signed up with us. So then after that dia kena pergi US untuk bekerja. So dia buat dulu treatment tu. Dia orang dah berkahwin 8 tahun. And of course dia juga pernah try dekat IVF center in Indonesia. But tak ada rezeki, so they come to Alpha and berjaya lah. Dia baru melahirkan baby 2 bulan yang lepas.
I see.
And it's like masa dia after OPU tu, OPU is a pick up lah. And I ada dengan teman dia, masa dia transfer pun I ada dengan dia juga. It's dia macam the feeling tu kan, macam when you hold our bestie tu, macam I rasa macam anak saudara I dalam tu. You know that
because you're a
feeling tu
mother.
tau. Yes.
Yeah, so you understand the agony or
And so bila
And
dia fly
the-
tu ada the bleeding tu kan, kita yang macam kancil. Call doktor, my sister bleeding, how? Doktor tak angkat phone, ketuk pintu semua. That's the things lah, yang small little things that make us human and touching lah actually.
Yeah, as human, for myself would be the energy, to help as many patients as possible. Sometimes you have to admit like aging kan. So they're 50 plus. So sometimes, to wake up early
No,
morning.
you're not 50 plus.
I am 50 plus.
No, you're not.
So we start as early as 7 something. I do my first case of egg pickup, OPU, like we say, egg pickup, as early as 7:45 in the morning every day. So for almost coming to 20 years now. So the energy to move on, So sometimes it's not that we don't want to do, we can't do. So the challenge for me is to find the energy to still be there for my patients, to help as many as possible. But every time you have a success, like you say, the bell of joy, then you perk up, better than double espresso lah.
Okay. So okay, itu maksudnya dah dari segi patient experience kan. Ada tak okay, you dah sampai boleh jadi bestie dengan a lot of your patients. So it's a very personal and a very intimate punya treatment lah, as compared to other treatments that people seek for. Because IVF ni, yelah orangnya I think mostly would be healthy people. They're not actually sick ke apa ke. So you share, the experience together. Ada tak any for doctor, any patient, because you've been working in this field for the past 20 years. Ada tak this one patient yang you memang tak boleh lupa? Maybe it's your first case, it's your first success case ke, atau macam
We
mana?
try to remember all our patients. There's so many interesting stories. So we've been there for so many years. Kalau nak cakap satu persatu, I think you take it at night. So of course, things that let's say in general that still hot in my memory. I'll tell you my first set of triplets. Back in the day lah, zaman dulu lah kan. This is like we're talking about 16, 17 years ago. We put more than one embryo because the technology back then was not that great. So as mathematics, we put more lah kan. So those days I put 3, which I don't do now. We do single embryo transfer now, one by one. So we put 3. She got triplet. The triplets, 2 boys, 1 girl. They're already almost college stage by now.
Okay.
So every year they still send me happy Chinese New Year messages. My birthday they still send presents. So and I watch them grow. They the mommy doesn't need IVF anymore. She's got 3, 2 boys, and they're really like elderly teenagers now. So but they still come and see me every
Still
year.
in touch.
So that's those very heartwarming lah. Which makes it fulfilling for us as
Still very
doctors.
grateful that
Yeah.
you
For sure.
help them.
For sure.
Ada seorang ni patient ni, Dr. Leong ni patient kat Surabaya. Remember tak? That one I text you, the baby heartbeat dah tak ada tu.
Yeah, that's right. Yeah, so that lady was they had problems. They tried in their own country, cannot. Then we came to us. So we did IVF first time. She got pregnant. She was bleeding, and then at first the baby's heartbeat was not visually seen on the scan. She was very upset, I was also very upset. But we hung in there with her, So we told her, be brave. We gave her all the support medicine. She even stayed, I think in Malaysia for 3 months, I think. She even had extended visa, stay with us, as medical treatment. She was so confident that she's comfortable rather with us, then the embryo developed, bleeding stopped, we managed to stabilize it, she went home, she delivered, and she's still sharing, Insta and everything with us until today.
Then bila kita every time, because it's based at Surabaya, every time kita ada kat Surabaya, she will come and support us. Dia bawa kawan-kawan dia, that kind of bonding is like, okay, how to say, money is everything, but
Yes.
not everything is money. This is beyond that kind of love already.
Yes. So I think that's very interesting. Actually, you don't actually think about having a relationship beyond doctor and patient, but it's very different for IVF because I understand people who are trying to conceive. It's something that is very taxing, and to wait for macam miracle baby lah, kan? So I'm sure they are all eternally grateful for all the success that you guys have
We're very
given.
happy to help.
Yes.
So in terms of advising your patients, the fathers, the mothers, for it to become a success punya case lah. Are there any tips, for your patients? Do you give tips for them before they come for the treatment ke atau during the process ke?
It's not really tips lah, not tips. But
Lifestyle.
But one thing I always tell my patients, or tell the public, like if I have a chance, kan, so that to get it out of the head, kan, jangan anggap, do not consider this infertility, ketidaksuburan, as a taboo subject.
Yes.
Sebab maybe it's the Asian culture, maybe it's just people, private, kan, they make it a taboo subject. Benda yang tak boleh disebut. I very embarrassed lah. Embarrassed, to tell people, to tell my parents, to tell my friends to seek treatment. I always tell them, ketidaksuburan, infertility is a part of disease. That's why it's handled by doctors.
Yes.
Not by
It is-
non-doctors.
So it's not your fault. Do not feel
Correct, not
bad
their
about
fault.
it. Yeah.
It's think of a disease. You see, if you have diabetes, what do? You see doctor, you take diabetic treatment, you get better. Alright, you have high blood pressure, darah tinggi, you seek doctor treatment, you ambil ubat, you get better. Same thing, infertility, seek the doctor, get treatment, become parents. So I always tell them, get rid of that taboo, get rid of that pantang or whatever that thing that you have in your brain. If you think of it, it's a disease, it's a medical condition. That's why medical doctors are dealing with it. Get treatment, be happy after that.
Okay, so if we have interested mummy and daddy to be's yang berminat nak go for this treatment, especially with Alpha IVF, what would be the first step? Kita boleh walk in je ke atau kena make an appointment ke?
Ni management je jawab ni.
Ada apa-apa documentation kena prepare ke?
Okay, the first step, kita tak encouragekan walk in lah. Because kita punya queue kat panjang. Nanti kalau walk in tu lama pula kena tunggu kan. So please macam contact us in advance. Make your appointment first. Okay, so tadi menjawab the first step, apa yang dia perlu buat kan sebelum dia go through the IVF journey. Okay, if I can elaborate awal sikit. Any challenges on the infertility is because 30% from the husband, correct me if I'm wrong, doctor. Okay, 30% from the mother, 30% both of them, 10% is unknown reason.
Okay.
Unexplained.
Unexplained. Tak tahulah daripada bulan bintang manalah the 10% tu kan. So the first step tadi, kita kena datang untuk fertility assessment. Ujian kesuburan. Dua-dua sekali datang. Suami, isteri, papa, mama. So nanti balik rumah tak boleh blame the husband tak boleh blame the isteri. So that's the first step. So apa yang kita akan check yang ujian yang pertama ini, husband straightforward. Nak check dia punya sperm je. How handsome the sperm are. Handsome ke tak handsome. Okay. So the mother, kita buat USG scan. Kita akan tengoklah dia punya kandungan telur. That's what doktor mention tadi sebelumnya. We might, umur kita mungkin 30 tahun. Tapi badan kita mungkin 20 tahun. Mungkin 40 tahun. So that's why itu penting. Then result tu kita akan dapat dalam masa 4 jam waktu bekerja.
Wow.
Yeah.
That quick.
Yes. And then from the result, only doktor akan advise which treatment yang sesuai.
Okay. So maksudnya ada pelbagai treatment even before the kita panggil apa, before all this embryo.
Diagnosis, yeah. Because
Yeah.
based on diagnosis, we have to treat accordingly lah. Like I said, it's not a thing. It's like a disease. You know, the doctor have to make diagnosis, so we know which part to tackle and try to achieve the main goal lah, which is success pregnancy lah. Kan.
So ada tak yang datang tu, okay, bila dah buat all this assessment, tak ada sperm atau tak ada egg, macam mana? Ada apa?
I mean, yes. Okay, kalau kita bezakan kepada male infertility, female infertility kan. So let's talk about male infertility. So of course, sperm is the key factor lah kan. So it can be poor sperm. You know, I don't want to talk about zero sperm lah, poor sperm. So naturally, that kind of sperm may not father children. You know, so they need help. So by IVF, how we help is we handpick the good sperm. And then we fertilize the egg with the good sperm, the best sperm. So we maximize the success, we get the embryos, and we can transfer back to the mummy and she gets pregnant. So in cases of poor sperm, because of many factors like maybe infection before that, you know, viral ke, bacterial ke, ataupun genetics.
So when you talk about poor sperm ni, maksudnya
Katakan sperm dia tak cukup banyak, concentration is low, ataupun movement is bad, a lot of dead sperm. Dia ada sperm tapi semua mati. So the condition in the testicles.
Ada apa-apa treatment tak untuk that particular?
That like what we mentioned earlier, the problem, the testicles, the cells cannot regenerate. So it's a bit tricky, that one. So we normally can give supplements, you know, antioxidant ke, vitamin E ke, zinc ke, which things that we know the sperm needs. So to help, but sometimes it may still be the same state. So we have to progress to IVF. In worst case scenarios, when there's zero sperm, ataupun kita panggil sebagai azoospermia, in medical speak, means the semen, air mani, there's no sperm inside. We look at it, it's just like nothing. So we will do some tests, of course, hormone blood tests, that kind of thing, to assess whether the testicles are still functioning. It may be functioning, but the sperm is so bad that it cannot even come out. So we have to do a surgical sperm extraction. So basically our urology partners will surgically extract some biopsy some tissue from the testicles, and we can extract sperm from there and we freeze. Then we use the frozen sperm for IVF.
Maksudnya masih possible
We have
even
so
after
many pregnancies.
assessment, zero sperm pun masih possible.
Yes. Yeah.
Kalau dah dua-dua ni, both also kita try memang no. And then we no options lah. Kita we have also sperm donations program.
I see.
And also egg donation program.
Okay, so tadi when you talk about your body age 20 tahun ataupun 30 tahun ke kan, mungkin umur 30 tapi badan tu masih macam 20 tahun sebab you aktif, ataupun 40 tahun sebab more on your lifestyle ke macam mana. Is it possible for you, okay, at first I pergi dekat you umur I 30, bila check my body age, you dah macam umur 40 ni, is it possible for me to reverse that? Change my lifestyle and then change the ovary punya quality juga.
Unfortunately, the biology of the human being is that, which a lot of people don't know, maybe is good, you know, for audience to listen to and understand, is that for female, you cannot generate eggs. So you're not making the eggs. A lot of women think, I make eggs every month, I have period,
bukan macam tu.
You know, bukan macam tu. So you are born with a certain amount of eggs. Let's say X amount when you're born, you know, by your mummy, and these eggs will stay with you in your ovaries. Okay, and it stays there your whole life, your whole riwayat. Those are the eggs you have, not any extra more, because you cannot make them. Once you reach to akhir balik puberty, those eggs will get active. Not actually satu-satu. You think satu-satu, you have a batch of eggs on standby every month, left and right ovary. Cuma your body will izinkan satu untuk membesar. Sebab sebagai manusia, kita punya DNA, one baby. Not like animals kan, beberapa sekaligus kan. So manusia, we kawal, body kawal, DNA kita kawal. Satu membesar, if the thing comes, the egg is released, or kita panggil ovulation lah. Ovulation berlaku, not met by a sperm, the egg will die, period will come. When the period comes, the other batches of eggs on standby mati sekali. Then next month, another batch of eggs on standby, one is released, ovulation, tak jadi apa-apa, the whole batch dies. So every month since teenage girls, they've been releasing batches and batches of eggs daripada dia punya X amount. Okay, cuma withdrawal, tak ada deposit. So semakin kurang, akhirnya kehabisan. What happens? Menopause.
Kita menopause.
Why women menopause? All women will menopause. kalau panjang umur lah kan. So because they run out of eggs. Men, not fair kan?
Yeah.
They generate sperm. The cells in the testicles make the sperm. Sperm is not there already. They are being made every day. If he's healthy, he will still generate sperm until 60, 70 years old.
Okay, so meaning we cannot generate new eggs. Tapi
no.
tadi waktu the first segment you kata bila kita nak freeze kan the eggs, kita nak basically keluarkan lah these eggs and sperm from the mummies and daddies.
Yeah. How's that?
You inject some hormones for the eggs
So
to
good
multiply?
question, very good question in fact. Okay, so bayangkan this. Okay, imagine this. Alright, so tadi I kata every month you have a batch of eggs on standby kan? Secara normal biology, your body izinkan satu membesar. Yang lain you suppress. Lepas kalau tak jadi apa-apa, the whole batch gone kan, gone. So katakan this cycle. Okay, your body nak keluarkan satu telur, tapi I intervene. I want to do IVF for you. I bagi you hormone. What I'm doing is I'm asking all those eggs on standby sekaligus semua menjadi matang. So instead of one mature, I get all mature and then I harvest them out. Now these eggs, if I don't take them out pun, when the period comes, they're gone. So I'm not causing the woman to have less and less eggs and menopause early. No, not at all.
Because at one time memang
will be
akan
gone
ada
anyway.
this amount.
Yeah, so I take them out first and give them hope for the future.
What is the rough amount yang you akan take out tu?
Totally dependent on the person. Like you said earlier, you may be 20 plus, but your ovaries may be functioning like a 30 plus, meaning less eggs lah. So it's a lot to do with genetics, a lot to do with whether there's any infection to the ovaries before, bacterial infection that may destroy the eggs. Cysts, a lot of women you hear they have tumbuh cyst dekat ovary kena operation ke apa. Those cysts will damage the eggs as well. So which make the X amount yang saya kata tadi tu lagi kurang daripada yang sepatutnya. So, and some women are blessed, they are genetically born with more eggs. Those are the ones that will menopause very late. Ada perempuan 50 lebih pun menopause, dah tak menopause lagi sebab they are born with more eggs. So, a bit difficult. But in general, after the age of 37, the deterioration or the drop of the X amount tadi tu will be quite drastic lah. Yeah.
What is the youngest patient and the oldest patient yang you pernah receive?
Wow, I have patients as young as early 20s. Why they need to do IVF, you might ask, at early 20s? Because they have, like I said, some problem inside. The tubes are blocked. So because of infection dulu, the tubes are blocked. So the kita panggil fallopian tubes kan, yang sambungkan rahim kepada ovary. So where the eggs and the sperm can meet. So if it's blocked, it's impossible naturally to have baby, no matter how young you are. So they have to do IVF.
So you need to extract.
Yeah, so they're happily with children. So oldest, of course, of the age factor, like I say, you have less eggs. The eggs are not so healthy anymore because of age. So I've helped women, they're mid to late 40s. The challenge is higher, obviously, because of like what you said, the numbers, less kan, tapi it's not impossible.
Okay. So just now during our break, kita ada cakap pasal PGT-A testing. Maybe Doktor dan Miss Linda boleh cakap sikit pasal.
Yeah, we can talk about PGT-A. PGT-A is an acronym lah. Dia stands for Pre-Implantation Genetic Testing for Aneuploidies. Big words, but what it means is pre-implantation means sebelum baby dalam rahim. Okay. Genetic lah. Kita test genetik dia. Aneuploidy adalah abnormality in the DNA or chromosomes. Kalau yang ada kromosom yang tak normal, kita panggil sebagai aneuploid. When there is a normal chromosome, kita panggil euploid. So we look for aneuploids, yang mana-mana embryo tak ada problem. So in a nutshell, it's also IVF, like what we talk about. The eggs come out, we fertilize dengan sperm dekat lab, we get the embryos. Sebelum kita freeze the embryos for future use, we biopsy. Kita gunakan laser, kita buat satu lubang kecil pada dinding dia. Kita biopsy some cells.
And it doesn't kill the
No, not at all.
cells.
Not at all. 0%. Because the embryo at the time, day 5, day 6, kita panggil blastocyst or embryo matang. Dia ada 200 lebih, 300 lebih cell. I'm just going to pull out 5 or 6.
And
It's like a
this
pinch.
is, okay, because I'm trying to imagine the cells must be micro.
Yes, all this is done under
all
microscope.
this is under a microscope.
Correct, very fine techniques, fine movement. The embryologist must be very well trained.
So the
to do
laser pun
biopsy.
macam not
Yes.
seen by the.
It's called non-contact laser, so it must not harm the embryo. So imagine it look like a bunch of grapes kan? Big bunch of grapes. I'm just pulling a few grapes out.
So if I
tak
duduk
nampak apa.
sebelah, I tak nampak pun lah ada laser.
Tak nampak. Tak nampak. You tak nampak embryo pun. You just look at a petri dish macam kosong. So under microscope high power kita nampak. So we take out the cells with biopsy and then we check the DNA from the cells, which is reflective of the whole embryo. Sebab sel tu yang daripada embryo. So the DNA of those embryos, the cells we biopsy denotes the DNA of the embryo lah. So kita tahu dia normal, ada sindrom ke, ada any problem dengan apa-apa ke. Even the sex boy girls we won't know because we check the DNA mah. So of course the abnormal ones nobody want, we will have to throw away. It's not going to cause it's not going to result in pregnancy. Even if it's pregnancy, there's probably going to be miscarriage, keguguran.
So daripada egg tu sendiri dah boleh
daripada
identify
embryo tu.
embryo.
Embryo kita dah tahu dah. You know, so we want to have a child with syndrome or anything kan. So then we transfer the normal ones to maximize the success rates.
So you pick the best out
You
of
pick the normal ones
bunch.
and the best quality ones, you know, to advise the patient. Maybe you like to put this one in.
Atau daripada segi bahasa mudahnya sebab kita bukan medical
Ya,
background macam doktor
cuba
kan.
nak faham.
Ya, so macam PGT-A tu kita ambil yang frozen yang embryo tadi tu, kita ambil a little bit secebis saja yang daripada sel yang embryo yang banyak-banyak beratus tu, daripada yang sel yang sikit tu kita akan buat genetic test. Dan kita akan tahulah sama baby tu, embryo tu baby boy, baby girl, dia ada Down syndrome ke tidak. So kalau embryo tu dah sihat, bila lepas buat test tu kita dah akan dapat result kan, baru kita tanam dalam rahim. So jangan berbuat begitu that kita dapat meningkatkan peratusan kehamilan yang sihat lah.
Betul.
Yeah.
So we can do even very advanced things like we've helped so many, and some of them is we at Alpha, we are the first in the world to do it. You know, when we publish it. For example, imagine you ada parents ada genetic mutation.
Okay.
Katakan, let's say the Chinese community in Malaysia, a lot have this what we call thalassemia. Thalassemia tu darah tu dia tak berapa ni, tak bagus kan. So kalau dua-dua suami isteri ada thalassemia, you may have a chance to get a child which is thalassemia major, which can die or die very young and need regular transfusion, which is not great lah. So we can test those embryos sama ada dia ada thalassemia major tu ke tidak. Kalau ada, kita jangan transfer, kita transfer normal. So that genetic mutation will not carry down to the next generation.
Wow.
You know, so we can do that. We can, you know, you talk about congenital deafness, macam you know, hearing loss yang turun temurun, albino yang putih tu, all those, you know, the hair when the hair is white. All those things is in the genes, which we can find
And dah
out.
boleh identify as early as
We
that.
can, but you must let us know what to look for. So genetically, we can look for those things. We have even done a case of kita panggil HLA matching, where there's a thalassemia parents, okay, they give birth to a kid with thalassemia major. So the kid needs weekly blood transfusion. We know by the time he reaches 20 or 30, so he will probably pass off because of heart failure, that kind of things. Too many blood transfusion. In order to save the boy, you need bone marrow transplantation yang matching. So the parents also did not have a second child, but they takut thalassemia major again.
Yeah.
So came to us. We did IVF. We did the PGT-M to look A to look for normal, then M to look for whether got thalassemia ke tidak. So we found embryos that ada thalassemia, so safe.
So dalam banyak-banyak tu ada possibility ada yang tak
And
ada.
on top of that, we did PGT-HLA. HLA is to check for whether which of the embryos punya genetic macam makeup the HLA paling match the living brother yang ada thalassemia.
Wow.
So that after they were
Boleh
born,
rawat.
they can become bone
Wow.
marrow transplant donors. And we've done it. They've delivered kids like that, so that in the end, when they grow up bigger, they can help their sick brother.
And this is the first, tadi doktor tadi cakap,
the
the
first
first in
one,
the world.
the first in the world this one we did in 2019. We did IVF.
So Malaysia was the first to have
Correct.
this
Yeah, we
technology.
were a lot of world's first, which a lot of people don't know.
Yeah.
You know, yeah.
In Malaysia and also Alpha IVF yang pertama.
Wow.
Bukan setakat Malaysia je.
Itu yang
Yes.
penting sebenarnya.
Yeah.
Kita nak highlight.
Ah.
Okay, so semua treatment ni bunyi dia sangat rumit, sangat advanced. So I think those yang interested sangat nak tahu in terms of payment plans dan sebagainya. But we'll take a short break and then we'll continue with that. Thank you.
Alpha IVF's group vision is to further enhance our position as a world leader in IVF with a mission to empower every couple for parenthood through effective technologies, innovation and positive patient experiences. Guided by values of excellence, innovation, integrity and quality, Alpha IVF Group stands out as a world leader in IVF by achieving numerous world firsts and world-class IVF success rates up to 87.5%. This excellence is supported by revolutionary and effective technologies such as piezo ICSI, the Cryotec freezing method, and the comprehensive embryo selection system, enhanced with cutting-edge artificial intelligence aimed at maximizing patients' IVF success rates. The group is also recognized for its innovation and research with more than 200 scientific publications. The team, powered by industry pioneers and icons, consists of highly qualified specialists, embryologists, and an international scientific board, is committed to pioneering the next generation of fertility treatments. Looking ahead, Alpha IVF Group remains steadfast in ensuring your journey to parenthood is characterized by innovation and excellence. Alpha IVF Group, generating generations.
Okay, so tadi kita ada nak bincang pasal payment plan tu. But before we go into that, I actually still have a few more questions. When you talk about these treatments, let's say money is not a problem for the patients, and katakanlah the treatment tu mungkin yang pertama tu tak berjaya. Okay, they want to try again. Let's add another embryo ke apa ke. So how many times can one do and actually go through this treatment? Ada limit tak?
Yeah, like we've talked about earlier kan, kita gunakan telur pada cycle yang itulah, the period cycle yang itu, tak affect period cycle yang akan datang. So we're not going to cause any problems in terms of getting less eggs ke, problems in the future ke. So there is technically no limit as long as you still have eggs, you're still ovulating, still having periods, so it's still reproductively active, yeah. So you still can do it because you're not causing any harm. Of course, there will be some gaps of maybe 1-2 periods in between. Of course, you can't just do it every month. 12 cycles a year again. So there's a rest period of 1 or 2 months normally. It's actually fine depending on what they are looking for. For example, let's say more embryos to store. So they want to have a big family, or sometimes even in our best interest, the cycle fails, the embryos are not utilizable, not good enough to be used, they have to repeat another cycle. So there's technically no limit.
So when you in a way take out these cells, is it invasive? Minimally ke atau macam mana ke? So if benda tu tak unsuccessful, do they have to go back to step 1 ataupun you take out as many ke?
Very good question. Yeah, it has to be invasive sebab ovary tu kat dalam body kan, dalam inside our pelvis, the female pelvis. So but the process is not rumit, it's not complicated. It's like taking blood. Imagine if your doctor helps you take blood. I'm sure most adults will have blood taken before kan, one reason or the other. So it's like a little needle in the picagari, in the syringe kan, we cocok through the skin into the vein, and then kita sedutkan darah tu. Same thing, same size punya needle, cuma panjang sikit.
Wow.
Kita tusuk melalui vagina. We go through the vagina. But it matches taking blood. Neither through the skin, neither through the vagina.
Hence why you can do it over and over
Correct.
again.
It's just like it's just like taking blood.
Yeah.
Some people donate blood kan, every 1-2 months they donate blood kan. So it's like a bigger needle, that one even through the vein. This is a small needle to the vagina to suck the eggs out. So it is, although invasive, it is just like taking blood. No big deal. So but of course because it is through a sensitive area, so the lady has to be sedated. So a pakar will give sedation.
Okay.
Process takes about 5 minutes, 10 at most. Yeah.
Okay, so when you talk about IVF, you consider the probability. Mungkin kalau masuk 1 tak jadi, masuk 2, 1 jadi, masuk 3, 2 jadi ke, macam mana ke? So ada apa-apa rules tak?
Yeah.
As to how many you can put at once.
Well, it is a game of probability, kebarangkalian, like you have mentioned. But if you play the game wrong, more than one yang melekat, you get twins ke triplets, it can lead to disaster, complications of the pregnancy. Of course, parents might feel very blessed, very happy kan, tapi we as doctors, we know things may happen in the future. For example, lahir pramatang, premature labor, because the mother cannot carry more than one baby in the womb, she goes to labor early. Let's say as early as 5 months, 5.5 months, 6 months, the ending may not be that perfect for the kids. Because of lack of oxygen, they cannot breathe properly, they cannot drink milk properly themselves. Then we have issues. May even lose the child. May have oxygen deprivation, the quality of child is no good in the future, so many complications. Although there's no rule, like you've asked, there's no law specifically when it comes to how many embryos we can transfer. As clinicians, we always advise them satu persatu. Satu persatu. You have all the time in the world. We have the best freezing technology now. Whatever we freeze the embryos now with Cryotec, I can guarantee my patients the survival after 1 year, 5 years, 10 years. Kalau I defrost, 100% survive. Not a single embryo will be wasted, will die. So there's no worry about freezing embryos. Those days, people put a lot also because they cannot freeze properly. You freeze, nanti keluarkan, nothing survives. So we can freeze.
When you talk about freezing, there's a certain temperature kan you simpan the embryos, the eggs, the sperm.
Yeah.
And when you take out before antara tempat freezer tu, you take out, lepas tu you nak,
Yeah, it's not as simple as macam you take out from your freezer nak masak kan.
Macam mana?
It's not,
Ada possibility tak bila dia dah
it's a
thaw tu,
complicated process.
tiba-tiba mati
Yeah,
ke?
it's a complicated process. That's why in the past, that's why it took many years for people to perfect that for
Yeah.
IVF. Yeah. So and then even back in the day, it's a older fashion of freezing, which there will be some embryos that may have damage, or even not survive. But in modern day, in Alpha, what we use something called Cryotec. It is 100% survival. It is so advanced and so proper that nothing will be lost. So there's no fear nowadays.
So the apa tu dia panggil transfer tu takkan affect
Takkan
lah.
affect because the embryo when we talk out kita defrost, they as good as new. Macam masa dia fresh.
Okay, kalau I boleh tambah sikit yang teknologi ni, Cryotec ni, for the embryo post-thawing process tu kan, our success rate is 100.0%.
Wow.
Why is 0.0%? Kalau kita punya success rate 99.9%, kita jadikan 100. Right? Kalau 97.6, kita bundakan jadi 100.
Okay.
Right? When I say it's 100.0%, meaning
Memang
zero
tak
failure.
tak pernah fail lah.
Yep. So that's why kita
Memang selamat lah.
Memang selamat, insyaAllah. We got will, it will selamat. That's why kita selalu advise patients tanam satu. Because rahim kita cukup untuk satu. So dia bayangkanlah macam kalau dua dalam satu tiga
Sharing.
sharing kan.
Tapi ada tak orang yang teringin nak ada twins?
Ada
So
juga.
dia request.
As a human beings kan
Human
ada.
beings kan.
We advise. We
Okay,
advise.
so you advise because you
medical,
know the mother's body capable of macam
Doktor akan
apa.
advise, kita akan advise. By the end, patient the one yang akan buat decisions.
Yeah, in some countries, there's the law to put one. What do you call like Scandinavian countries? Is the law to put one. The doctor is not allowed to put more than one because of those some very advanced countries. All these medical bills is from the taxpayers' money. So bayangkan you ada twins, triplets, and you have to use a lot of taxpayers' money to. I mean, it's not fair to the country, so to speak. Yeah.
Okay. So we go back to kita punya perbincangan payment plan tadi. Of course, it sounds so advanced. Macam laser tadi semua. I'm still trying to imagine
Macam
the
Star Wars,
lab. Yeah, like how much does that all cost? Kan? It must cost a lot. So and of course, I'm sure ramai yang berminat for this treatment. So mungkin they want to go for this treatment, but they are concerned in terms of, financially mampu ke? I want to go through this. So ada macam kind of payment plan ke atau macam mana by Alpha IVF?
Okay, I do agree. Cost dia mahal. Actually, kita punya antara yang termahal lah. Why mahal?
Because of
Supporting
the
one,
success
teknologi
rate.
dia, doktor yang handsome macam ni. I mean like doktor yang professionals, yang berpengalaman, and embryologist kita pun berpengalaman. Embryologist kita, they produce more than 200 research paper.
Wow.
So dia memang expert in that line, and kita buat semua everything under one roof. Kita tak ada sub kat orang lain. We have a lab, everything, mak-mak semua dalam kita. So actually Alpha IVF Kuala Lumpur adalah one stop center. You datang je, insyaAllah kita will take care from A to Z. Tak perlu nak sub ke sana, sub ke sini lagi. So far Malaysia hanya ada Alpha saja macam tu. And then bila datang yang benda-benda advance macam ni, color-colorful macam ni, of course cost dia juga mahal lah. And kita juga di Alpha, we understand that IVF ni dia bukan journey A to Z. There's a very roller coaster punya journey, up
Yes.
and down, emotions pun banyak terganggu di situ kan.
Mm-mm.
So a few kita juga macam menawarkan lah beberapa financial aids untuk mengurangkan tekanan-tekanan papa dan mama ini. Okay, kita pergi pada Malaysians dulu. Okay, Malaysian ni kita ada banyak sikit pilihan. Contohnya EPF, account 2. Kita
Boleh pakai
Yes,
EPF?
boleh.
Wow.
EPF account 2, credit card certain bank,
Okay.
termasuk juga bank major CIMB, Maybank tu semua tu 0% interest. Insurance, certain treatment kita boleh claim. So far I think dekat Malaysia kita ada Pure Man dengan Pure Lady under Prudential. So far yang dua ni lah, tapi tak boleh claim 100%, tapi ada certain
Adalah,
percentage on that. And kita juga ada working closely with our partner financial, dia akan bagi something like macam personal loan. Tapi dia bukan bank lah, dia financial provider. Memang diiktiraf oleh bank negara, MDN Capital.
I
Kita
see.
work out with them on this. Okay, tu Malaysians. Untuk Indonesia, unfortunately kita tak ada skim loan macam itu, tapi kita ada platform untuk memudahkan payment. Contohnya Mandiri Remittance. Macam Mandiri Remittance ni under Mandiri Bank. Mandiri Bank tu macam Maybank kita lah kat Malaysia. Okay. So sebab cost dia kan banyak kan, 30,000, 40,000 kadang-kadang kan. And then credit card kadang, you know lah, credit card kita guna untuk benda lain juga. So limit tu dah lebih.
Betul.
That's why macam Mandiri ni, patients daripada Indonesia ni, dia transfer kepada Mandiri Remittance. And then Mandiri Remittance ni dia akan transfer duit kepada kita. So dia tak ada kacau ada credit card. And then dia tak ada extra charge pada Alpha, tak ada extra charge pada juga patient. Maksudnya kalau cost tu 20,000, patients hantar ringgit Malaysia 20,000 kepada Mandiri Remittance ni. Mandiri ni akan transfer duit amount yang sama juga. Patient tak ada akan tambah extra ke, tak ada. So dia tu Mandiri Remittance. And satu lagi yang ni kita baru sign, Flip. Flip ni macam touch and go. Dia
For
scan
Indonesia
je.
juga?
Yang tu Indonesia punya platform, gateway, payment gateway. Dia scan je. Terus tak perlu nak key in bank data kan. Macam Mandiri tu kena key in the form semua. Mandiri ni dia scan je. Macam touch and go lah. Scan je macam QR code. Macam tu.
Macam e-wallet macam tu lah.
Yes. Yang tu terus dalam masa 20 minit terus masuk duit. Again, tak ada special any extra charges on the patients. So yang tu untuk memudahkan payment.
Okay. Alright. So when you talk about...
lupa satu.
Oh ya. Tak apa, sila-sila.
Satu lagi kita boleh claim income tax juga untuk Malaysia.
Wow.
So kita nak meramaikan umat kan?
Ya, betul.
So boleh claim income tax.
Okay. Alright, so bila sebut pasal Indonesians dan your other international patients lah, I'm trying to understand the whole process. How long does it take? And contohlah, bila you ada international patient, adakah dia kena stay, dia kena stay dekat Malaysia tu berapa lama? Lepas tu dia kena balik ke, ataupun dia kena datang semula ke, atau macam mana?
Yeah, because we've been doing international patients for so long kan, so kita dah have the experience. Kita ada experience untuk cuba buat senang untuk bagi mereka, ya. So minimal stay in Malaysia, but still give you them the maximal results. So for example, let's say from different country they come in to see us, kan, they can even do a video conferencing with us first beforehand. So give us all the
They don't need
information,
to
kita dah
datang.
tahu semua dah. So they set up a meeting. They can come like a vacation to tour to Malaysia for the first time, like under the MHTC punya ni guide kan.
Betul.
So they come here at the same time they enjoy Malaysia, they understand our country, they come and see us. It's just going to be a day trip. Kita assess dia, kita buat scans, kita buat all the check-up, blood work, everything. And they are ready, they want to do, they're sure they want to do, they can take all the medications back home, all the hormone injections back home. We teach them how to use it. They can even learn it from YouTube actually. So then they bring home, back to the country. When they're ready to start, it could be a month later, 2 months later, depending on their schedule, their work schedule, social schedule. They start injection. Really start injection. Normally it takes about 2 weeks of injections for the telur to matang. So the first week is done back in the home country. But they ada injection. So they'll call us, okay, look, I started. They only see me day 7, katakan, halfway through. So the next day 7 to day 14 untuk keluarkan telur, they're in KL. So it's just minimum stay 1 week. Then they go back to the country. Once we have the results, the embryos, we've done all the testing, they're ready for transfer, they fly in for transfer, next time. So it's very minimal stay.
Tapi ada tak patients yang dia stay je?
Ada. Macam I said just now, the patients who to extend visa, I even had very trusting Indonesian patients. This was many years back. I think easily more than 10 years. They stayed the whole 9 months. They want me to deliver the baby after IVF. So even to the extent, I have patients from the US. In fact, I have a patient from US now who's left the country and decided to stay here for 3-4 months for the IVF statement. Because US, we hear traveling is quite difficult, but they are willing to put off everything aside for 3 months. So we don't necessarily need that, like I told you. We can make it easier for them, but some people, they just want to do it.
It depends on the budget actually.
So for those yang berminat nak stay, ada apa-apa package macam travel package ke by Alpha IVF?
Okay, kalau yang untuk ujian kesuburan tu tadi tu, yang first fertility assessment tu memang kita ada untuk package. Kita ada 2 lah. Satu is a la carte, just treatment saja. Satu lagi kita ada bundlekan untuk airport sekali and hotel. Hotel kita bagi 5 bintang. Dia orang 2 hari 1 malam.
Okay.
So yang untuk bila yang treatment tu kita boleh sarankan, because kita ada tie up agreement few of the hotels yang ada corporate rate dengan kita. So kita kan boleh advise and boleh tolong buat booking.
Okay. So maksudnya adalah different kind of packages untuk our international patients. Because like kita bincangkan tadi, bila dia datang for IVF treatment, they're healthy.
Yep.
So they're bukanlah macam handicap ke apa ke. So untuk dia go for a vacation pun it's very.
Kebanyakannya patient kita pagi tu dia dah siap transfer AP card ke apa, petang tu boleh jumpa dengan KSCC dah. Life macam biasa. Tapi janganlah lepas treatment tu you pergi mountain climbing ke, hiking ke, tu janganlah. Tapi hiking dalam shopping mall dibenarkan, disarankan untuk release stress.
I got patient said, Doctor, are you going to take long? I supposed to go Genting after this.
Ada.
Our international patients,
Oh, maksudnya kenapa tak boleh pergi hiking atau ada sebab ke? Nak
Let's
kena
say already
jaga.
on the treatment, the eggs are almost ready. We don't want to have so much trauma. But the early part, where the eggs are baru starting, of course, they can visit Malaysia, do all the nice things in Malaysia.
So
but
not to stress the body lah.
Yeah, let's say embryo transfer, lepas embryo dah dimasukkan, the transfer we ask them to rest for a few days kan.
Okay, so maybe boleh consider for more packages to include more of our tourism products ke
Durian
apa.
fest.
Kan? Boleh kan makan durian walaupun tengah go through IVF?
Not too much please. Sugar levels will go up.
Ke ada apa-apa pantang dari segi makanan? Ada ke diet? Ada pantang apa-apa for those
be
going
as healthy
through?
as possible. I mean, people who smoke a lot, cut down. People who drink a lot, cut down.
Coffee boleh.
Coffee is not proven unless excessive. Kalau caffeine, we're talking caffeine lah. Coffee is not caffeine kan. Kalau satu cawan, 2 cawan, until 2 cawan per day is still okay. But it is noted for guys, 3 cups and above, which I think rarely orang minum 3 cups and above kan, may cause DNA problems in the sperm.
Oh, for men.
For men. Yeah. So if it can happen to men, we sure, in the ladies a bit harder to check kan. I tak boleh keluarkan telur check kan. So like sperm kan. So but we sure if it happens to men, ladies probably in some extent will be the same. Tapi nobody will drink more than 3 or 4 cups per day. I think that's
Bottom line dia berpada-pada.
And try to be as healthy as
Yes.
want to take supplements. People who always active lifestyle kan, selalu makan fast food aja ke, not proper meals ke. Supplements is the way to go. Yeah.
Okay, so next year, MHTC is actually going to have our very first Malaysia Year of Medical Tourism, which is in conjunction with Visit Malaysia 2026. So Alpha IVF ada apa-apa plan ke for this, exciting year in 2026?
Tonight you can't sleep, a lot of things to think about.
Actually memang as I said that kita Alpha IVF Kuala Lumpur adalah antara elite member yang aktif di dalam MSTC. Actually kita dah start dah. So actually for the past few months kita dah start dah. Kita visit a new market. Contohnya macam Middle East, Cambodia kan. Kita dah start promote Alpha IVF dan secara tidak langsung kita promote juga Malaysia.
Okay. So, saya pun dah dapat cue. We're just gonna wrap this up. Tapi before we go, maybe just a one-liner ke as to why orang di luar sana, dalam banyak-banyak fertility centers dekat Malaysia ataupun in the whole world, kenapa Alpha IVF?
Okay. Sebab dia Dr. Leong.
That's exactly what Linda said. Not about me, but about being a one-stop holistic center.
Yes.
So you want to go to a center which can offer you a lot of options because you don't know what is your problem. So when you go there, if this problem A, we have a way for it. Problem Z, we have a way for it. So in Alpha, we offer the whole gamut, the holistic approach to IVF. So that would be the reason. Because of, like you say, one-liner, holistic approach.
Yeah. One-stop center.
One-stop center. Okay, I think throughout this about 1 hour session, I think we've learned so much on IVF. I know I've learned so much lah on this particular
you.
treatment. So we hope this will help orang yang mana seek for this treatment. So thank you so much, Dr. Leong.
Most
for having
welcome.
us.
Most welcome, Hamidah.
Thank you. So we'll see you again in the next episode.
Okay.
Bye-bye.
Thank you, everybody.